Hey, good afternoon. Happy lunchtime. This is Dr. Myckatyn at West County Plastic Surgeons of Washington University. And I'm here today to answer questions and talk a little bit about a couple areas. One is brow lift. Another one is the use of Botox for the brow. And then also I'm going to talk a little bit about the applications of these specifically in men. So today is going to be some general stuff for men and women on Botox and brow lift. And then I'm going to kind of take the conversation a little bit on the male end, so-called brotox or Botox for men and where men may consider using this product. So let's start by talking about the brow lift. So essentially, when we are talking about brow lift, what I'm talking about is the brow being sort of this upper third of the face. As plastic surgeons and cosmetic surgeons, we tend to divide the face into thirds: upper, middle, and lower. And the neck often is sort of a separate area, or sometimes considered with the lower third of the face. And so we're going to focus up here today. So the types of structures or features of the brow that we're interested in rejuvenating include the actual position of the brow. And a couple interesting tidbits about that, and the way that we're thinking about this as cosmetic surgeons, includes the position of the brow. So as we age, and sometimes for genetic reasons, etc., the brow tends to descend down. So in men, we tend to want the brow at about the level of the orbital rim. So that basically means that ridge at the roof of the eye socket. And then other times, or in women, pardon me, we want the brow to be a little bit higher than that. And, for years, women have been doing this simply by modifying their eyebrows with plucking or with makeup to give it either a more arched or a higher position. The eyebrow itself is not a straight line, unless you're Charlie Chaplin or something, but it is a structure that is curved, and the apex of that curve tends to sit at what we call the lateral limbus. So essentially, if you look at an eyeball, and then you look at the iris, which is the colored part of the eyeball, the outer part of that color is the lateral limbus. So we kind of want the arch of the brow to sit at that position. Next, we have the position in the arch. The other features of the brow include sort of what's going on in between. So that is these lines here that we refer to as the glabellar furrows. We're also interested in these transverse, or these lines across the forehead, which are the basically the forehead lines. And to an extent, these lines along here, which are developed when the circular muscle around the eye, called the orbicularis oculi, flexes, and it creates these straight lines perpendicular to the contraction of that muscle. We call those crow's feet. So we're thinking about all those structures. There's a couple other things that we're considering as well, such as the location of the hairline. We're also considering what we call the anterior temporal crest. And so that's basically, if you were to bite down with your jaws, you can feel that muscle in your temple, your temporalis muscle. The front edge of that is sort of a bit of a grooved or crested part of the skull called the anterior temporal crest. And that also is a landmark that defines our brow. So what can we do to raise the brow? So there are several different options, and those include what's called a direct brow lift. So that's essentially an incision literally right over the eyebrow crease, where we can take a little ellipse of skin and tack the brow in a higher position. That is not a particularly common operation. We do that often more in men or people who already have deep furrows here, or perhaps they've already had some type of a surgical procedure where they have a scar located there or trauma or something. But it is a fairly effective, quick way to raise the brow, and we can anchor the brow in a higher position through that. Sometimes if somebody is having an upper eyelid lift or a upper eyelid blepharoplasty, we can, through that approach, also do a brow pexy, meaning that we can go through the upper eyelid incision and take our surgery up and then put sutures or stitches to anchor the brow in a higher position through the eyelid incision. The other brow lift approaches, which are more common and more traditional, are those that sort of start at the front of the hairline and work back into the hair. And there are several different variations. So one is what's called an endoscopic brow lift. And what that means is we make anywhere between 1, 3, or 5 incisions, typically up in the hair. Often they're vertically oriented. And those incisions are made up in here, so the scar is well concealed. And then we use an endoscope, which is essentially a camera on a tube with light, and we can pass instruments in through those small ports to manipulate the brow. The endoscopic brow lift, I think, is particularly effective in controlling some of these forehead lines, some of these lines here in the furrows. And essentially, it's like using Botox, but a much longer term solution, often decades worth of a solution in terms of reducing or eliminating some of these creases. So that's what's called an endoscopic brow lift. And there are little almost like carpet tacks known as endotynes and other techniques that can be used to anchor the brow in a higher position through that endoscopic approach. Now, other cases though, we want a more aggressive brow lift. And for me personally, in a patient with a heavier brow, somebody who he wants a more substantial lift, somebody who has thicker hair, often in males as well, will do an open brow lift. And what that means is an incision is made, and it can be either at the level of the anterior hairline, so it's well concealed at the back of the hairline, or it can be brought back in the hair. And no, we don't shave your head to do this. We often maybe take a tiny little strip that we shave, but the rest of the hair is there so that it's that scar is well concealed. And we get into the brow and lift the brow through that approach. That approach affords us, I think, the best lift of all of those techniques. And again, we can control the creases, and we can control the creases here between the eyes or just over the nose. But it is, that has to be balanced with the fact that that is a more substantial scar and that there can be more numbness in through the forehead after surgery. There's other variations. Sometimes we do what's called a lateral brow lift, often with endoscopic assist. And what this is these are incisions way back in the hairline. They're usually about 5-6 centimeter incisions here. And then we do the brow lifting through those. And so we use a little bit of an endoscope there to help guide us. And it's something in between an endoscopic brow lift and an open brow lift. But that's particularly effective for raising up the outer or the lateral eyebrows for patients. So, which procedure are we going to choose? It depends if our goals are raising the eyebrows, how much we're raising the eyebrows. It depends on whether the primary goal is to remove some of these lines in a more permanent fashion. Sometimes people are asymmetric, meaning one side's higher than the other, and we may modify our technique. So there's lots of different considerations when we make a decision about which type of brow lift procedure to use. And again, the relevant anatomy there is the eye socket, the eyebrow position, this muscle called the frontalis, which when it contracts causes creases in this direction, but raises the eyebrow up and down. And the what's called the corrugator muscles here, and the glabellar muscle or procerus muscle here, which are muscles that cause some of the furrowing and creases just above the root of the nose and between the eyes. So the brow lift procedures, especially the endoscopic and the open procedures, are typically done under general anesthesia. Direct brow lifts can be done under local anesthesia, but they're therefore, I would say, most commonly done under general anesthesia. The scars are, of course, planned such that they can be well concealed. The endoscopic and open brow lifts are typically within the hair or at the front of the hairline. So while they are, there are definitely scars that are made in surgery, they can be well concealed. Of course, we have to consider, like if somebody, like in males, for example, that may have male hair or male pattern baldness. For example, we have to be particularly careful where we make the scars. Often in women who have longer hair, it's a lot easier for them to conceal the scar location. So another option is to use Botox in order to facilitate a brow lift. So Botox is one of the most successful drug launches in the history of the world. Botox comes from essentially something called botulinum toxin. So back when I was growing up, Botox was a poison. It's something that you could get, botulism, from eating spoiled foods. And essentially this bacteria would release a toxin, and it would essentially paralyze the diaphragm or the breathing muscle, and essentially cause people to go into a respiratory failure or an inability to breathe or to ventilate. And so clever people, the Carruthers family from Vancouver, which is my hometown, actually studied this agent, and they found, for example, that they were using, Jean Carruthers was using Botox in order to weaken certain muscles in children. She was a pediatric ophthalmologist, so to weaken certain muscles to correct imbalances of the eyes, or something called strabismus, in order for children to be able to have better control of the movements of their eyeballs. Her husband happened to be a cosmetic dermatologist, and they tested this and did a lot of early work to determine the safety of Botox and the indications for the use of Botox. But essentially, at very low doses, Botox can be used to paralyze very specific muscles with an extremely acceptable safety profile. And so this was sort of the origin of Botox in the mid-90s and into the late 90s. And so it finally got its FDA approval for injection of glabellar furrows, and really the rest is history. There are now dozens and dozens of indications for the use of Botox for all sorts of things, some cosmetic and some very medical or functional. So how it goes with the brow is that you have a muscle, which is called the frontalis muscle. And this muscle's function is to elevate the brow. And when I do this, you can see when I'm elevating my brow, I have all these wrinkles. And these wrinkles are caused because these wrinkles are perpendicular to the direction of pull of this muscle. And so obviously I need Botox because you can still see some. But essentially, we would use Botox in and around these muscles to weaken them some, so they're not contracting as forcefully, and therefore can reduce or eliminate some of these creases. So in a brow lift, also you have a force, which is the frontalis muscle, which is pushing the brow up. And then you have another force, which is the orbicularis oculi muscle, which is the circular muscle, which is pulling the brow down. So with Botox, you can adjust that balance. So out here, you want more upward pull, but and you want less downward pull. So, hello, this is Dr. Myckatyn, West County Plastic Surgeons. This is part 2 of our discussion of brow lifts, Botox, and brotox. Sorry, we had a technical issue and we got cut off there. So I'm just going to start in on where we inject Botox to lift the brow. So what we're trying to do is weaken the downward pull of the orbicularis oculi muscle. So we inject Botox there, and and that causes the upward pull of the frontalis muscle to work without as much resistance. And what the effect of that is, because this one muscle isn't pulling the brow down, this upward pulling muscle has an easier time of it, and the brow can come up. So that's what we are doing with the chemical brow lift, it's called, or a Botox brow lift. And we can keep these muscles here firing up. And if somebody still has some wrinkles in the center, this part of the frontalis muscle isn't really doing much to raise these the eyebrow. So centrally, we can still inject Botox to get rid of some of these central wrinkles, yet inject Botox down here to weaken the orbicularis oculi muscle, so the frontalis is still on the sides, working to lift it up, the eyebrow up over there. So that is what some people call a chemical brow lift, and that is how we would use Botox to achieve that. Now, Botox only lasts for just over 3 months, and so it's good and bad. If you don't like the effect, it's only 3 months, and it's disappointing if you like the effect, and then you need to repeat it again. However, Botox can be done at lunchtime, for example. The recovery is very quick. It's just maybe sometimes a little bit of swelling. Sometimes there can be just a little drop of blood wherever the Botox was injected, and your injector just has to be careful not to inject it anywhere close to a blood vessel, such as a vein, to prevent more bruising. There are limits to how much Botox can be injected, again, so that we're well within the safety profile of Botox. But what are some areas where men may benefit from Botox? So definitely men have deep furrows in many cases, deep furrows in many cases. This is not unique between men and women, but it's something that men can consider as well. So Botox in this area is very common, and similarly in the crow's feet area, to give a sort of a more rejuvenated, more rested look. So that's where you could consider Botox in a male. And certainly essentially any area where you can inject Botox on the face or the trunk of a male, or a female could also be considered in a male. There's a couple other areas where guys may not have thought about it as much. One is these bands here underneath my neck, which are called the platysmal bands. If somebody's not interested in a facelift or some kind of a surgical procedure to rejuvenate the neck, Botox can be injected into these bands to soften them a little bit. Also, Botox can be used to control sweating and perspiration. So some examples. So some men will have excess sweating or hyperhidrosis of the armpit area. Botox can be injected into the armpit area to essentially uncouple the nerves that create the sweating from the sweat glands. And so Botox can be very effectively injected into the armpit to reduce sweating. So, for example, somebody may think there's no way that I would want to come to a plastic surgeon's office to get any Botox. I don't mind that I have a couple wrinkles. It makes me look distinguished, but maybe they're in the boardroom and, they're giving a presentation and they have sweatier armpits, for example. So, reducing this hyperhidrosis by injecting Botox into that area in a grid-like pattern, small doses of Botox through the armpits, can dramatically reduce sweating. Like other indications for Botox, this effect would last for about 3 months. One thing that sometimes comes up is, how long does it take for the Botox to take effect? In the majority of cases, it's taking effect within just a day or two, but it can take as much as a week, or in some rare cases, as much as 2 weeks for the Botox to really take effect. Another area where men or anyone may consider Botox, again, not as much of a cosmetic thing as you may think, but would be in the palms. So some people get very sweaty palms. And so, for example, a handshake, if somebody is sweating, can be embarrassing for some individuals. Again, you're meeting somebody at a cocktail party, you're in an important meeting, for example. So Botox can be, again, injected into the palms to reduce sweating as well. So armpits, palms, two areas where Botox can be injected to reduce sweating, and something you may not have considered. In addition to that, Botox can be used for things such as reducing some of the lines around the lips. Can't tell on me because I have a mustache. And Botox has been used in lots of other areas for other medical indications, for voice, for reflux, and many other reasons. All right. Well, this concludes part 2 of my discussion on brow lift and on Botox in general, Botox brow lift, and so-called brotox, or why men may consider using Botox. I hope you found that informative, and I wish you all a happy holiday coming up, and we look forward to seeing you for our next Facebook Live here in the next days and weeks ahead.